Hello, I am Bernard Dan, Editor-in-Chief of Developmental Medicine and Child Neurology. I recently wrote an editorial entitled Sleep as Therapy. Now, to highlight some of the key issues, I am having a conversation with Professor Phyllis Zee, who conducts both basic and clinical research on sleep at the Center for Circadian and Sleep Medicine at Northwestern University. First of all, Phyllis, do we know why we sleep?
This is a really important question with regards, why do we sleep? Why do we spend more than a third, of our 24 hours in this state of sleep? And what's really been, I think, quite exciting is in the last decade, we've begun to ask the question of what are the functions of sleep, not a function of sleep. And the data indicates that it's important for cognition, learning and memory. It's important for metabolic and cardiovascular regulation. It's very important for, of course, for alertness and performance. And I would say more recently, taking all of that into consideration, that it is essential for most of the basic mechanisms and functions that relate to health, again, from metabolism, inflammation, cardiovascular function, to neuronal activity and the health of that.
Which role do circadian influences play in the regulation of sleep?
Of course, circadian rhythms and sleep are very closely intertwined. The circadian rhythms are a regulatory system that regulates the timing of physiological processes, behavior, and this is occurring both from a molecular to the cellular, as well, of course, to the systems level. And as you know, very recently in 2017, the Nobel Prize in Physiology and Medicine went actually for the discovery of the circadian clock genes that regulate these circadian rhythms. So circadian rhythms not only time these physiological processes, but these genes are actually very much integrally involved in the regulation of inflammation, of metabolism, and then also of that of neural activity. So like sleep, they work together. So what's important about circadian rhythm with regards to sleep is that the timing of sleep is circadian regulated, and therefore, like shift workers or children who stay up really, really late and are using their phones and misaligning their circadian rhythms by inadvertent light exposure, for example, could really kind of misalign the normal timing of sleep that's dictated by the circadian clock system with that actually of the sleep behavior, resulting in inadequate sleep.
You are talking about sleep timing, but I suppose that sleep patterns are important too.
Yes, sleep has what we call sleep architecture. The sleep architecture is fairly dynamic. You go from being awake and usually within 20 minutes into a lighter stage of sleep, like we call stage 1 sleep, and then that progresses into deeper stages of sleep, like stage 2, and then eventually into stage 3, what we call N3, where it's deep sleep. And there's lots of this deep sleep when these waves are very slow, usually about anywhere from like 1 to maybe about 3 hertz per second. That is the state of sleep that appears, at least most of us think, is the more restorative, because when you deprive individuals of sleep, this is the sleep, the stage 3 sleep that rebounds dramatically, and it's been associated with improvements in cognitive functioning as well as metabolic activity. And then there's this very interesting stage of sleep called Rem sleep, or rapid eye movement sleep. This tends to occur more in the second half of the night, and particularly close to the time of natural awakening. And REM sleep is a state where the brain actually is relatively activated, certainly very different than slow wave sleep, where it's fairly slow. This is actually fairly activated, and yet your muscle intermittently is, I would say, unable to move or paralyzed, because this is the stage of sleep where most of the dreaming is occurring, not exclusively, but mostly is occurring. And this intermittent muscle paralysis prevents us from physically acting out our dreams.
You mentioned that sleep deprivation can alter sleep patterns. Are there other important factors that modulate them?
Sleep architecture is modulated these different stages of sleep, especially REM and non-REM sleep, in different regions of the brain. The non-REM sleep, such as 1, 2, and specifically 3, these rhythms are generated both in the thalamus as well as, of course, what we record is recorded from the cortex. And so these are generated, whereas REM sleep, or rapid eye movement sleep, is predominantly generated in the brainstem, so kind of in the lower parts of the brain, the brainstem area, where especially in the pontine, in the pons. And the neurotransmitters are also quite different. For example, for non-REM sleep, both in thalamic and also in the hypothalamic area called the ventrolateral preoptic nucleus, the primary neurotransmitter is GABA, which is a major inhibitory neurotransmitter. Whereas for the primary stimulating, activating neurotransmitter for REM sleep is acetylcholine, so it's really mainly cholinergic. So it's really this balance between these neurotransmitters and these brain regions that are either stimulating sleep and are promoting wakefulness that creates the pattern of sleep architecture throughout the night, but also, very importantly, the maintenance of alertness and wakefulness during the day. And that is primarily regulated, again, where acetylcholine is high, but at the same time, so are the monoaminergic systems like norepinephrine, serotonin, where both monoamines are activated as well as acetylcholine. That is a state of wakefulness.
This is the dialogue at the level of neurotransmission, and one way of interfering with it might be with drugs, but I guess there are less direct ways of modulating sleep activity, including slow wave activity.
Indeed, there are several ways to modulate slow wave activity, and there are behavioral methods. One of those would be exercise. So there's studies showing that structured exercise can also increase slow wave activity during the night. The other way that's kind of more recent and there's been gaining, I think, a reasonable amount of attention has been what we would say neurostimulation during sleep. This can be accomplished by electrical stimulation with direct current, which has been proposed and has been used, and that also can increase slow wave sleep. Magnetic stimulation can increase local slow wave sleep in individuals during sleep. But we have used, and others like Dr. Bourne, what we've used is I think a more practical method and perhaps safer, is that of acoustic stimulation. So these are sounds that are played during sleep that are phase locked to specific waves during sleep. And what we're choosing in this case is a slow wave. So when we place a stimulus at the upstate of each of these slow waves, we find that, one, it enhances the amplitude of the slow wave. And the increase in the amplitude and also the amount of slow wave activity has been correlated in both young adults as well as in our study in older adults with improved in memory and in particular declarative types of memory consolidation.
Do you think this approach might be developed for people with brain disorders and even children with neurodevelopmental disorders?
Yes, absolutely. I think that's very common and, kind of a hallmark sometimes of neurodegeneration and or neurodevelopmental disorders, and particularly during development, because children have a lot of deep sleep normally, whereas as you get older, you begin to lose some of that. And in neurodevelopmental disorders and in most sleep disorders, what you find is this decrease or impairment of slow wave sleep is a characteristic of this type of sleep disturbance. So therefore, yes, given that slow wave sleep has such an important role in both memory consolidation and learning, metabolic activity, inflammation, and all of this is, of course, is going to affect brain development. I do believe that methods to enhance slow wave sleep, including acoustic stimulation, holds promise for helping improve the quality of sleep in these children and, of course, also adults. But more importantly, that sleep improvement will be associated with improvement in neuronal function and activity. And as you know, one of the kind of really cool ideas right now, and there's data to support that, is that during sleep, you actually are able to enhance the clearance of toxic molecules, especially large molecules, that build up, of course, during the day as a consequence of thinking, as a consequence